everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Let's talk about facial feminization surgery for trans women or trans feminine identified people, and let's discuss about what surgery will and what it will not do for your face. This is very important because I see a lot of people going through the surgery expecting this completely radicalized, drastic results to their face and then getting their hopes sadly crushed when they don't really get them. And that happens for a lot of reasons, but primarily it happens because facial feminization surgery is really not intended to completely give you a fully formed female face. It's just impossible for you to do that. Facial feminization surgery is really there to take the features that you already have and then do the best it can, depending also on a surgeon and their skill set, to feminize those features as much as possible as they can. But sometimes I hear people have some crazy expectations, such as I'm gonna go under knife and then when I come out, I'm gonna look completely drastically different to the point where my passability will be absolutely 500% and nobody will ever blink an eye. And that sadly doesn't really happen. It happens for some, and I'll tell you which categories those people tend to fall into. But for a lot of people, that doesn't happen. Again, that's because facial feminization is not intended to do that. It's intended to feminize features you already have. So the surgeon goes in and then they have to work with the bone structures that's already underneath. And what they do is they soften up the bone structures that's maybe sharper or harder in some individuals. So for example, they will soften up the jawline, or they'll, shave down the forehead. They'll do forehead reduction. Then for some people who have more protruding noses, they will do rhinoplasty. They will do cheek implants or lip fillers, anything to really kind of soften up and feminize facial features to make it more feminine in this kind of anatomical ways that a female face would look. Because as we know, men's faces tend to be more square-shaped, more kind of harsher, a little bit more broader, and that's because of the testosterone. But again, the surgeon has to work with what's already there. They can't just remove your head on an operating table and put in a different head in there. And as much as all of us wish that was possible, at least I think some people wish that was possible, that is not reality. So having realistic expectations about what facial femme is going to give you is really, really, really important, because I see people constantly setting up these crazy unrealistic expectations only to find themselves incredibly, incredibly crushed. As I said earlier, there are some people who get incredible feminizing results, and let me tell you who they are. Usually, those are individuals who are already have a much softer facial features. A lot of them have a much more androgynous facial look to them. Their bone structure tends to be a little bit softer. So as you can see, that gives a surgeon an opportunity to feminize that even more and to bring some of the features forefront. So those people usually have a higher success rate than somebody that, due to testosterone and due to their genes, due to their biology, tends to have a little bit harsher faces. They're going to be still feminizing, but not really feminizing to the extent where it's going to be, 500% a fully feminizing face. I mean, I haven't seen that in individuals who have a harsher border features. Now, that does not mean that the facial feminization surgery is going to be a waste of your time. And I don't think it will. And I think for a lot of people, even if the results are not as we envision in our heads, in majority of the people that I work with, it makes a tremendous, tremendous difference. Just softly feminizing certain aspects of your face can really be a game changer. So I don't think that a facial femme has to be disregarded, but I do think that it is incredibly important to form realistic expectations about surgery and what surgery can and cannot do. When you go to a plastic surgeon, depending on who your plastic surgeon is, and some of them are very, very good and very honest and will work with you and will honestly give you realistic expectations of what might happen. And some of them, as we know, are incredible salespeople. They can sell ice to Eskimo, right? So you go there and suddenly you went there for, minor modification. Before you know it, they're drawing all these lines with a Sharpie on your face. Well, maybe not a Sharpie, but they're drawing lines on your face. I think we may not all experienced it, but we've all seen it at least on a media and in a movie. And so a lot of them are kind of very salesy in their way. And as a result, they will sell you on much bigger expectation, but won't often deliver. So be careful when you go to plastic surgeon. Take everything they give you. And then I would say just drop your expectation a little bit more. If your expectation will skyrise after surgery, that's fantastic. That is so great, and imagine how happy you'll feel. Now, but if your expectations are going to plummet because they're already so high up and you didn't get the results, they're just going to be really heartbreaking and can also spin you into post-surgical depression, and we don't want that to happen. So have realistic expectations about facial femme. It's not, like I said, it's not going to radically give you a different face. It will feminize. That's what it's meant to do. That's why we call it facial feminization. It's sent to feminize facial features you already have in order to bring you closer to that passability, if trans-binary passability is your goal. Comment below if you had a surgery before, if you had FFS before. What were your expectations? Were your expectations too high? How did it go? What was the outcome for you? If you do plan to have facial feminization, do comment below. What are your expectations? What are your fears? What are your hopes? What do you think you're going to achieve? How realistic are you being on that kind of reality spectrum? But I do think it is incredibly important to keep our expectations realistic as possible. I think that's going to really help you in the long run. So hopefully you guys find this helpful, and I'll see you all next time. Bye.